Next, we have Francesco Branca. Francesco is the Director of Nutrition for Health and Development of the World Health Organization. You're actually a real nutritionist on this panel. In your past life, you critically did address some of the bioactive compounds, I understand, in diets, so taking a dietary approach is something that you can probably contribute to. So Francesco, what do you think of this marriage? How is it going? How can we affect? But I really particularly think that you can start commenting on the dietary approaches. And if they're married, there doesn't appear to be a very healthy marriage. Are you nodding, dating, married, or unaware?
Yeah, thanks, Bonnie. Well, I'll give you some facts. The scope of nutrition challenges in the world is enormous. We basically have no countries, in fact, Global Nutrition Report says there's only 2 countries in the world, but it might change. No country is immune from nutrition problems. We still have 159 million children under 5 with stunting, 50 million with wasting, about 500 million women with anemia, 2 billion overall with vitamin and mineral deficiencies. We have about 800 million people with insufficient energy in their diet, and at the same time we have 500 million people obese, and even children under 5. We have over 40 million children who are overweight. So almost you have the same number of overweight and wasted children in the world. So that's the fact. And clearly we need to have food systems which delivers good nutrition. So I would say that probably what happens in long marriages, people change. And agriculture is not agriculture. I can't recognize it any longer. It's actually food system. It's not only about production. It's about transformation and distribution. So clearly these food systems are not able to deliver the good nutrition to all. We have a lot of inadequacies. We have dietary quality which is poor. We have insufficient nutrients in the diet. We also have excesses. And we all know that excesses in fat, sugars, and salt produce a lot of problems in terms of risk of non-communicable diseases. We would like to see a healthy diet delivered to all, but that's actually not possible. Healthy diet can only be afforded in some situation in rich countries, in rich communities of rich countries. So clearly, either if there's been a marriage in the past, either there is polygamy, or actually the agriculture has preferred another partner, and has preferred a partner which seems to be more important and give more remuneration, it's profit. So if we want to have this marriage back, we need to change things dramatically. We need a food revolution, as some people have called for. The good news is that we do have an agenda. We had last year an important conference, the second international conference on nutrition that FAO and WHO convened jointly, and member states, 170 member states represented at a very high level, agreed on outcome documents, made commitments, agreed on a framework for action, which first of all talks nutrition, says that nutrition can be achieved in multiple sectors. It's about agriculture, health, social protection, education, environment, water and sanitation. It talks about food systems that need to be aligned to nutrition outcomes. And food systems also means trade, it means investments. So that alignment and that policy alignment is going to be crucial if we want to bring the marriage back. We need to have a good way to monitor that. We need to have good metrics. We need to analyze the nutrition impact of policies and investment before we do that. That's going to bring us back on track. Thank you.
Thank you, Francesco. It sounds as though, yes, married, but not necessarily a healthy one.